Endometriosis. This condition affects millions of women worldwide, causing significant pain and impacting their quality of life. It's a disorder where tissue similar to the lining of the uterus grows outside the uterus. This misplaced tissue behaves as if it were inside, thickening, breaking down, and attempting to shed each month. Trapped within the body, the shedding tissue triggers inflammation, irritation, and pain. Over time, it can lead to scar tissue, known as adhesions, which can bind organs together. Endometriosis is not just about painful periods, it's a chronic inflammatory response that can affect multiple systems. Understanding this complexity is the first step towards seeking proper diagnosis and management. Endometriosis does not discriminate. It can affect women of all ages, races, and ethnicities. While the exact cause remains a mystery, several risk factors increase the likelihood of developing it. One significant risk factor is family history. If your mother, sister, or aunt has endometriosis, your chances are higher. Early menstruation and frequent periods also contribute. Women with cycles shorter than 28 days or prolonged periods are at increased risk. Never having given birth is another risk factor. Pregnancy seems to offer some protection, possibly due to hormonal changes. Endometriosis can occur in women without these risk factors, and not every woman with them will develop the condition. The interplay of genes, hormones, and environmental factors is complex and not yet fully understood. Endometriosis is often called a silent condition because its symptoms can be subtle or mimic other conditions. This makes it challenging for many women to get a timely diagnosis. Recognizing the warning signs is crucial for early diagnosis and management. Early intervention can significantly improve quality of life. The most well-known symptom is pelvic pain, particularly during menstruation. This pain can be severe and debilitating. Women with endometriosis often experience excruciating pain that disrupts their daily lives. This pain can interfere with work, social activities, and personal relationships. This pain is often described as sharp, stabbing, or burning. It can be persistent and unrelenting. Many women experience chronic pelvic pain throughout their cycle. This ongoing discomfort can be both physically and emotionally draining. This pain can radiate to the lower back, legs, and rectum. It can make simple activities like walking or sitting very uncomfortable. Intercourse can also become painful, impacting intimacy and relationships. This can lead to emotional stress and strain on partnerships. Some women experience painful bowel movements or urination, especially during their periods. This can be a source of significant distress. Others may have digestive issues like diarrhea, constipation, bloating, or nausea. These symptoms can be mistaken for other gastrointestinal disorders. Fatigue is another common complaint. The chronic pain and inflammation can leave women feeling constantly tired and drained. The scar tissue and inflammation caused by endometriosis can affect fertility. This can be a heartbreaking challenge for those trying to conceive. Up to 50% of women with endometriosis experience some degree of infertility. Early diagnosis and treatment are key to managing this condition. Diagnosing endometriosis can be a long and frustrating journey, often filled with uncertainty and emotional distress. Its symptoms mimic other conditions, making it often misdiagnosed or dismissed by healthcare providers. The diagnostic process begins with a thorough medical history and a detailed pelvic exam, which can provide initial clues. Your doctor will ask about your symptoms, their severity, and timing in relation to your menstrual cycle, which can be crucial for diagnosis. They will also inquire about your family history of endometriosis, as it can run in families. During the pelvic exam, your doctor will check for abnormalities in your reproductive organs, such as cysts or scars. Imaging tests, such as an ultrasound or MRI, may be ordered to get a clearer picture of your internal organs. The gold standard for diagnosing endometriosis is a laparoscopy, which allows direct visualization. This minimally invasive procedure involves inserting a laparoscope through a small incision in the abdomen, providing a direct view. The surgeon can visualize the pelvic organs and look for endometrial implants, which are indicative of the condition. A biopsy may be taken during the laparoscopy to confirm the presence of endometriosis through microscopic examination. Laparoscopy is the most definitive way to diagnose endometriosis but requires surgery and general anesthesia, making it a significant step. There is currently no cure for endometriosis, but various treatment options are available to manage symptoms. Pain management is often the first step. Over-the-counter pain relievers can be effective for mild discomfort. For more severe pain, stronger medications may be prescribed. Hormone therapy is another cornerstone of treatment. Hormonal contraceptives can help regulate the menstrual cycle and alleviate pain. Other hormonal medications can suppress estrogen production, shrinking endometrial implants. Surgery may be recommended to remove endometrial implants, scar tissue, or cysts. Laparoscopy is the most common surgical approach. In severe cases, a hysterectomy or oophorectomy may be considered. Surgery is not a cure and symptoms may return in the future. Living with endometriosis can be physically and emotionally challenging. It often requires a multifaceted approach to manage the symptoms effectively. Prioritize self-care and seek support as you navigate this journey. This can include activities that promote relaxation and mental well-being. Creating a supportive environment is crucial. Surround yourself with people who understand and respect your condition. Talk to your loved ones about your condition and how it affects you. Open communication can foster empathy and support. Educate them about your symptoms and needs. This can help them understand what you are going through and how they can assist. Consider joining a support group or online forum. Sharing experiences with others who have similar challenges can be incredibly validating and comforting. Connecting with others who understand can be incredibly validating. It can provide a sense of community and shared understanding. Lifestyle modifications can also help manage symptoms. Incorporate regular physical activities that you enjoy. Regular exercise, even gentle activities like walking or yoga, can reduce pain and improve mood. Staying active is key. Eating a healthy diet rich in fruits, vegetables, and whole grains can reduce inflammation. Stress management is crucial for overall well-being. Explore relaxation techniques like deep breathing, meditation, or mindfulness. These practices can help manage stress and improve your quality of life. Prioritize activities you enjoy and practice self-compassion. Taking time for hobbies and interests can be very therapeutic. Remember, you are not alone in this journey. There are many resources and communities available to support you. Knowledge is power when managing a chronic condition like endometriosis. Arming yourself with accurate information can empower you to make informed decisions. Start with your healthcare provider. They can answer your questions and connect you with specialists. Numerous reputable organizations offer valuable information and support. The Endometriosis Foundation and the Endometriosis Association provide educational resources and support groups. The National Institutes of Health and the Office on Women's Health offer reliable information on symptoms, diagnosis, and treatment options. By educating yourself and seeking professional guidance, you can navigate this journey with confidence. Disclaimer: the content in this video is for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always consult your healthcare provider before starting any new medication, supplement, or lifestyle change. Do not disregard or delay seeking medical advice based on information presented here. We are not liable for any risks, damages, or outcomes associated with actions taken based on this content.